Hmm? Hi, I'm Dr. Kawita Bapat. Today I am giving you the practical introduction of modern practices, that is AI for OBGYN. It's a live promotional session. Welcome to this session. This introductory session sets and stage, and today we will understand what AI means, what AI means for OBGYN work in a daily practice, what it helps, where it helps, how AI can help in teaching patients, research, and practice. Where to be careful, where caution is needed and limits must be respected. The full course, where you will learn the full recorded course. So, why this session matters, AI becoming a part of daily professionals, and OBGYN practice already spans many everyday tasks, and AI can support many of them when used wisely. Now, where the work happens in the patient counseling, teaching and training, academic preparation, literature reading, and documentation, as well as the practice communication. So, the key message is AI is not replacement for the key judgment, clinical judgment. Final clinical responsibility always remains with the clinician. So, AI can assist us with drafting, summarizing, explaining, organizing, and creating a teaching material. So, mindset is AI as a co pilot. Think of AI as a co pilot. It can help you move faster, but it should never take the final decision. Use AI to save the time on the routine task, improve the communication, create first drafts, generate ideas, and support your learning. Always verify before use. Whatever you do it cannot become the pilot. It is only the co-pilot because you are responsible for whatever you are drafting or doing things. Now, practical uses. How it can help us in a patient education. If you want to give some pamphlets or something to the patients, we can educate the patient through AI's help. We can also, if you are in a teaching sectors, you can teach the residents. If you were planning some lectures, we can plan the lectures, MCQs, Viva preparations, we can do with AI. Then literature summaries. So for example, if there are some literatures and you just want to summarize it, we can do with the help of AI. And then the documentation support, whatever the documents you are going to make, how it can be supported that way. And social media and a practice communication. If you want to promote yourself on the social media, make a small content through AI and post it into the social media. So, but there are limitations. The AI cannot do, it cannot examine the patient, it cannot take the medical legal responsibility, it cannot guarantee the accuracy of the time every time, it cannot understand the full clinical context, it cannot replace the clinical experience, and it cannot replace the guidelines or the protocols. So, every patient education for simplifying topic like PMOS, they can have in the medical language, in a patient friendly language, we can make it fibroids, menopause, pregnancy warning signs, contraception, and infertility counseling can be done through AI. Now, what prompt we should write to get the proper things? So, prompt should be, for example, if I have to write for the PMOS, so I'll write explain PMOS to the 25-year-old patient in a simple language. It should include the causes, symptoms, lifestyle advice, and when to consult a doctor and avoid the frightening words. So the prompt should be very, very proper. And what is the output? There will be clear explanation. There will be a simple points. There will be patient-friendly tone. And the counseling support will be there. Now, if you want for the resident teaching, supporting academic teaching, we can say what are the objectives, what are the discussions we are going to do, what are the Viva questions, what is the OSC stations, what are the MCQs, feedback points, and revision summaries. So, teaching prompt example, for example, we write create a case-based discussion for residents on a postpartum hemorrhage, include history, examination, differential diagnosis, management steps, and Viva question. This helps the teachers to prepare structured sessions faster. So the prompts are very, very important. For academic preparation, lecture outline, topic summaries, seminar planning, conference talk planning, slide structures, question banks, and journal club preparation can be done. So, better prompt, better answer. A vague prompt gives you a vague answer. So, good prompt gives better structure, depth, tone, relevance, and safety. The power of prompt writing is very important. So, if example, weak prompt writing, tell me about anemia in pregnancy. See, the topic is so varied. Problem too broad, no audience defined, no format defined, no clinical depth specified, no safety instruction. So the prompt becomes very, very problem. But if we want to give a strong prompt, then explain anemia in pregnancy for a first year OBGYN residents. They should include definition, causes, diagnosis, severity classification, management outline, counseling points, and mention that clinical guidelines must be verified. What we will get gives a more useful and a safer response. So, simple prompt, you should give the role, you should give the task, you should have the audience, you should have the format, and you should have the safety. For example, act as a medical teaching assistant, create patient counseling sheet of the gestational diabetes for the pregnant women in a simple language. Use bullet points, add a note to consult and the treating doctors. So, for example, we want to give the antenatal education, diet in pregnancy, warning signs, antenatal visit schedules, exercise advice, birth preparedness, breastfeeding preparations, and a postpartum care. So, in a gynecological OPD, we can talk about the fibroids, endometriosis, PMOS, menopause, prolapse, infertility, and we can talk about the abnormal uterine bleeding. Use it as a counseling support, but it is not an advice. So, make it a point very, very clear. It is not a final advice. Now, academic teaching again create a lecture flow, design the assignments, viva questions, planning revision sessions, preparing the case discussions, making MCUs, and structured feedback. So AI for the literature search, AI can reduce the reading burden. It can summarize the essentials, what you read. For example, big research papers on the PubMed or anything, or guidelines. It can review the articles. It can give the trial abstracts. It can give the key findings and it a limitation of the studies. So documentation support, patient instruction, discharge advice, counseling notes, procedure explanation, follow-up instruction, and a structured tablets. Do not enter the patient's identifiable details in open AI tools. This is very, very important. Don't write the name of the patient, age, or where you are operating or what you are doing. So it's very, very important. Do not enter it. And a practice communication, we can find out what are the awareness posts, patient education messages, clinical announcements, webinar options, post promotion content, YouTube descriptions, and WhatsApp messages. So this is for the practice communication we can do. But the biggest risk and the blind trust, AI can sound confident and still be strong, but they can give the incorrect answer, they can give the outdated information, the missing clinical context, overconfident language, incomplete explanation, and unsafe recommendation. Never copy and use without checking. So verification rule is always verify before using. Check it at the output again. First, find it out and correlate with the standard textbooks. Same with the guidelines. We should know the what guidelines you want from them and what guidelines are there and what is your institutional protocol. Sometimes every institution has got their own protocols. We should follow the protocols first and then the use of AI. Then recent literature, what they are saying, sometimes the AI gives the old literature thing. So recent literature is very, very important. And the clinical judgment, which is really our domain and we should follow it. And the pension context. For example, what sort of patient, 8th class education patient and MA class education patient. So we should have the difference between the both the type of patients while giving them everything. So review AI output before teaching, sharing in our clinical use. Then use AI responsibility. Do not enter any of the following into OpenAI tools. It's our responsibility. We should not enter the patient name. We should not enter the phone number, address, hospital number, reports with identity, images with identity, and any confidential support. AI is a support tool. It's not a legal sheet. So, in modules which we are going to teach over there in our course, there AI basics. Second is a prompt writing skill. Third module will be about education. Fourth about the academic teaching. Fifth about the clinical documentation support. Sixth is literature search and research. Seven is professional growth and communication. And eight is very, very important, safety, ethics, and medical legal supports. So these are the full course which will include, and it's a recorded course, and eight modules, learn anytime at your own pace. Who should join? OBGYN consultants, residents, faculty members, medical teachers, private practitioners, mentors, and anyone waiting wanting to learn about AI ready. Recorded modules let you learn anytime. So join the practical recorded course by Dr. Kawita Bapat and message AI for course details and precision. Thank you so much. Learn AI for patients, teaching, research, documentation, professional growth, and safe practice. Thank you so much. Ravi,